Most disease is preventable, not all. Genetics matter, bad luck happens, but the majority, preventable. Through lifestyle, through choices, through daily habits, heart disease, stroke, type 2 diabetes, most cancers, Alzheimer's. These are largely lifestyle diseases, created by how we live, reversible by how we choose to live. The standard American diet kills more people than smoking. This is not hyperbole. Poor diet is the leading cause of death, responsible for more mortality than any other factor. Processed food, sugar, seed oils, excess calories. This combination creates disease. Systematically, inflammation is the root of chronic disease, heart disease is inflammatory, cancer is inflammatory, Alzheimer's is inflammatory. Most disease involves chronic low-grade inflammation, damaging tissues over years until disease manifests. But you can reduce inflammation dramatically through diet, through exercise, through lifestyle. Processed food is pro-inflammatory. Industrial seed oils, trans fats, high fructose corn syrup, refined grains. These create oxidative stress, disrupt gut bacteria, trigger immune response. Your body recognizes processed food as foreign. This is inflammation. Chronic consumption creates chronic inflammation. Whole foods are anti-inflammatory. Vegetables, fruit, fish, nuts, olive oil. These contain polyphenols, omega-3s, antioxidants, fiber. These reduce inflammation, support immune function. The more whole foods you eat, the less inflamed you are. Obesity is an independent disease risk factor, beyond inflammation, beyond metabolic dysfunction. Just carrying excess weight stresses the body, the heart, the joints. Losing weight reduces disease risk, even without perfect diet, even without perfect exercise. Exercise prevents disease through multiple mechanisms. Improves insulin sensitivity, reduces inflammation, strengthens cardiovascular system, enhances immune function, maintains muscle mass. Every system benefits. No drug does all this, only movement. Cardiovascular disease is the leading killer, but it's largely preventable. Blood pressure control, cholesterol management, blood sugar regulation, weight management, no smoking. These prevent most heart disease. Exercise addresses all of these. Cancer is complex. Many factors, some uncontrollable. But lifestyle matters. Obesity increases cancer risk. Alcohol increases cancer risk. Processed meat increases cancer risk. But exercise reduces cancer risk. Whole foods reduce cancer risk. Maintaining healthy weight reduces cancer risk. Alzheimer's is increasingly seen as metabolic disease. Type 3 diabetes. Insulin resistance in the brain. What damages metabolism damages the brain. Poor diet. Sedentary lifestyle, poor sleep. But exercise protects the brain. Mediterranean diet protects the brain. Screening catches disease early, often before symptoms. Mammograms, colonoscopies, PSA tests, skin checks, blood work. These aren't fun, but they save lives. Catching cancer at stage 1 versus stage 4 is the difference between cure and death. Blood work reveals problems before disease. Fasting glucose, hemoglobin, A1C, lipid panel, liver enzymes. These markers show dysfunction before it becomes disease. High fasting glucose warns of diabetes risk. Know your numbers, track them, respond to them. Genetics load the gun, lifestyle pulls the trigger. Yes, some people are genetically predisposed to certain diseases. This doesn't mean disease is inevitable. It means you need to be more careful, more intentional, more preventive. The earlier you start, the better. Prevention works best when started young. Building good habits at 30 protects you at 70. But it's never too late. Starting at 50 is better than starting at 60. Starting at 60 is better than never. Modern medicine is amazing at acute care, trauma, infection, emergency situations, but it's terrible at chronic disease. Because chronic disease requires lifestyle change. You can't medicate your way out of obesity, can't pill your way out of diabetes. Medication manages symptoms, doesn't cure disease. Blood pressure medication lowers blood pressure, doesn't fix why it's high. Statins lower cholesterol, don't fix metabolism. These drugs are useful, sometimes necessary, but they're not solutions. The solution is addressing root cause. Why is blood pressure high? Poor diet, obesity, sedentary lifestyle, stress. Fix these. Blood pressure normalizes. This is actual treatment. Prevention is cheaper than treatment, economically, physically, emotionally. The cost of gym membership and healthy food is nothing compared to medical bills, compared to disability, compared to suffering. You can't prevent everything. Accidents happen. Rare diseases exist. But you can prevent most of the common diseases, the ones killing most people, through choices, through habits, through prioritizing health. Don't wait for disease to motivate you. Don't wait for diagnosis. Don't wait for symptoms. By then, damage is done. Start now, build health now. Create resilience now. So disease never gets a foothold. So you age without chronic illness. This is possible. For most people. Through prevention. Through lifestyle, through choice. Disease is not inevitable. Decline is not guaranteed. You have agency. Use it. Prevent disease, build health, live well.